Hello everyone, and today we are going to talk about intermittent fasting. Intermittent fasting is an eating pattern that cycles between periods of eating and fasting. It has gained popularity for potential health benefits, weight management, and improved metabolism. There are several popular methods of intermittent fasting. So let's first talk about 16:8 method. This involves fasting for 16 hours a day and eating within an 8-hour window. For example, you might eat from 12 pm to 8 pm and fast from 8 pm to 12 pm the next day. The next method is 5:2 method. In this approach, you eat regularly for 5 days a week and significantly reduce calorie intake for the remaining 2 consecutive days. Then comes the method which is called Eat Stop Eat. This involves fasting for a full 24 hours once or twice a week. For example, you could fast from dinner one day until dinner the next day. And then we have the alternate day fasting. This method alternates between regular eating days and fasting days, where you significantly reduce calorie intake. And lastly comes the warrior diet. This approach involves fasting for 20 hours and eating a large meal within a 4-hour window in the evening. So if you are planning to start intermittent fasting, start gradually. If you are new to intermittent fasting, it's best to ease into. Begin with a less strict method or shorten the fasting period. Then gradually increase it as you become more comfortable. During fasting periods, it's very essential to stay hydrated. Drink plenty of water, herbal teas or black coffee to help control hunger. Also, when you break your fast, focus on consuming whole nutritious foods. Include a balance of lean proteins, healthy fats, vegetables, fruits, and complex carbohydrates to ensure you are meeting your nutritional needs. Although intermittent fasting can be effective for weight management, it's essential to be mindful of portion sizes and not overcompensate for the fasting periods by consuming excessive calories. It's also important to pay attention to how you feel during fasting periods. If you experience severe discomfort or health issue, consider modifying your fasting approach or consulting with a healthcare professional. Intermittent fasting is most effective when practiced consistently. Stick to your chosen fasting schedule for several weeks to see the potential benefits. Intermittent fasting can be more effective when combined with regular exercise, adequate sleep, and stress management. And lastly, remember that intermittent fasting may not be suitable for everyone, especially those with certain medical conditions or specific dietary needs. If you have any health concern or condition, it's essential to consult with a healthcare professional before starting any fasting regime.